Welcome back. As Congress continues to debate the future of America's healthcare system, patients are starting to see the costs go up.
That's right. The Affordable Care Act subsidies are now expired, and the One Big Beautiful bill may make some heavy cuts to Medicaid. 11 Alive's Joe Ripley here.
Yeah, so Joe, explain how these changes will really, actually impact people here in the metro.
Yeah, we're starting to see that impact already here early in 2026. We spoke with doctors in DeKalb County about these changes. They say they are worried that an already challenging healthcare system could get even more challenging and pricier too.
Dr. Robert Contino runs Ethne Health, a clinic that largely serves immigrants and refugees in DeKalb County. He's kicking off 2026 concerned.
In Georgia, it's estimated that 750,000 people are going to lose their insurance. And I'm almost certain that the large majority of people that lose their insurance are going to be from lower income communities just like ours.
Contino says many of his patients, some of the most vulnerable, are going to be hit hardest by cuts to Medicaid and the removal of Affordable Care Act subsidies. In July, President Trump signed the One Big Beautiful Bill Act into law, which includes substantial cuts to funding for Medicaid and Medicare. In October, the government shut down over whether to extend the ACA subsidies, driving up insurance premiums this year.
We have to realize that health doesn't happen in a vacuum. We need the social services, we need the healthcare system to work together and seeing our patients not just as a number, but as our neighbors.
Contino's colleague, Dr. Esther Kim, is an immigrant herself. She says lawmakers should reconsider policies that increase access and affordability to care. Chris Denson with the conservative-leaning Georgia Public Policy Foundation says the federal government must rein in spending and cut waste. He says he does not expect Medicaid cuts to impact Georgians as much because the state did not expand Medicaid and does not pay as much as other states in provider fees.
Insurers are attributing the cost of the rise in health insurance premiums to structural pressures like higher medical utilization, inflation, hospital consolidation.
Dr. Contino says Congress needs to act fast because so much is on the line.
It can be devastating. It can be really a matter of life and death.
There's now a new push from the White House to adopt direct payments for those on the government health care marketplace. Many congressional Republicans are opposed to spending more on the Affordable Care Act subsidies. Earlier this month, Congressman Buddy Carter voted no to extending the ACA subsidies, saying patients deserve better than a system designed to serve big insurance and illegal immigrants. A debate we will be watching very closely as Congress faces a January 30th deadline to figure out what to do with these payments.
And we know this was the cause of the last shutdown. It all came down to the ACA subsidies. So sounds like they still haven't reached a happy medium.
No, not yet.
All right, deadline coming soon. Joe, thank you so much.